Good morning, friends. My name is Dhanvi Parekh from 9th B. Today I am going to give you some information on coronavirus, causes, effects, and prevention. Coronaviruses are a family of viruses that can cause illnesses such as common cold, severe acute respiratory syndrome (SARS), and Middle East Respiratory Syndrome (MERS). In 2019, a new coronavirus was identified as the cause of a disease outbreak that originated in Wuhan, China. The virus is now known as severe acute respiratory syndrome SARS COVID-19 2. The disease it causes is called coronavirus 2019 COVID-19. In March 2020, WHO declared the COVID-19 outbreak a pandemic. World Health Organization has declared this coronavirus a pandemic in March 2020. Signs and symptoms. Signs and symptoms of COVID-19 may appear 2 to 14 days after exposure. This time after exposure and before having symptoms is called incubation period. This period after exposure and before the symptoms is called incubation period. Common signs and symptoms can include fever, cough, tiredness. Early symptoms of COVID-19 may include a loss of smell or taste. Other may include shortness of breathing or difficulty breathing, muscle aches, chills, sore throat, runny nose, headache, chest pain, pink eye, that is conjunctivitis. Other less commonly symptoms have been reported such as rash, nausea, that is a feeling of sickness with an inclination to vomit, vomiting, and diarrhea. Children have similar symptoms to adults. The severity of COVID-19 symptoms can range from very mild to severe. Some people may have only a few symptoms and some people may have no symptoms at all. Some people may experience worsened symptoms such as worsened shortness of breath and pneumonia about a week after symptoms start. People who are older have a higher risk of serious illness from COVID-19 and risk increases with the age. People who have chronic medical conditions also may have a higher risk of serious illness. Serious medical conditions that increase the risk of serious illnesses from COVID-19 include serious heart diseases such as heart failure, coronary artery disease, or cardiomyopathy. Cardiomyopathy means disease of heart muscle. Cancer, chronic kidney disease, chronic obstructive pulmonary disease, COPD. COPD means it is a type of lung disease. Severe obesity, chronic sickle cell disease. It is a disease in which the RBC is in shape of sickle. Weakened immune system from solid organ transplants. Other condition may increase the risk of serious illness such as asthma. It is the disease in which it's difficulty in lungs taking breathing. It is a respiratory condition. Liver disease, lung disease like cystic fibrosis. It is a lung disease. Brain and nervous system conditions, HIV, high blood pressure. Emergency signs and symptoms can include trouble breathing, persistent chest pain or pressure, inability to stay awake, new confusion, blue lips, blue face. If these emergency symptoms are seen, you must contact your doctor. Causes. Infection with novel coronavirus causes COVID-19. The virus appears to spread easily among people. COVID-19 spreads by respiratory droplets released when someone with the virus coughs or sneezes or talks. These droplets can be inhaled or land in the mouth or nose of a person nearby. It can also spread if a person touches a surface with this virus and then his or her mouth, nose, or eyes. Risk factors Risk factors means when we get the infection of COVID-19. Why happens with close contact within 6 feet or 2 meters with someone who has COVID-19, or being coughed or sneezed by an infected person. Complication: what happens after we get the disease if left untreated. Although people with COVID 19 have mild to moderate symptoms, the disease can cause severe medical symptoms. The disease can cause severe medical complications and may lead to death. Older adults or people with existing chronic medical conditions are at higher risk of becoming seriously ill with COVID 19. Complications include pneumonia, trouble breathing, organ failure in several organs, heart problems, lung condition that causes a low amount of oxygen to go through your bloodstream to your organs, that is called acute respiratory distress syndrome, blood clots, acute kidney injury, additional viral and bacterial infections. Since there is no cure of this COVID-19 and it is said that prevention is better than cure, so now let's talk about prevention. There is no vaccine available to prevent COVID-19, so we can take steps to reduce risk of infection. Avoid large events and mass gatherings. Avoid close contact, that is within 6 feet or 2 meters, with anyone who is sick or has symptoms. Stay home as much as possible and keep distance between yourself and others, especially if you have a higher risk of serious illnesses. Keep in mind, some people may have COVID-19 and spread it to others even if they don't have symptoms or don't know they have COVID-19. Wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer that contains at least 60% alcohol. The figure is shown that how to wash your hands for 20 seconds. Cover your face with a cloth mask in public areas such as grocery store, where it's difficult to avoid close contact with others, especially if you are in an area with ongoing community spread. Only use non-medical masks. Surgical masks and N95 respirators should be reserved for healthcare providers. Cover your mouth and nose with your elbow or a tissue when you cough or sneeze. Throw away the used tissue. Wash your hands right away. Avoid touching your eyes, nose, and mouth oftenly when you are out of your house. Avoid sharing dishes, towels, glasses, bedding, and other household items if you are sick. Clean and disinfect high-touch surfaces such as doorknobs, light switches, electronics, and counters daily. Stay home from work, school, and public areas if you are sick, unless you are going to a medical care. Avoid public transportation, taxis, and ride-sharing if you are sick. If not possible to stay home on work, make distance within 6 feet or 2 meters, or in Hindi 2 गज का अंतर. Social distancing should be maintained. These are some preventive measures to reduce the risk of novel coronavirus. So this was my information. Thank you friends and have a nice day.